Hello, good evening, everyone. Good afternoon if you're in the US, or good morning if you are in the West Coast. We are giving a couple of minutes for people to log in. I can see already a few people logging into the platform. And then we will start with the introductions. So just giving a couple of minutes because I can see some attendees already joining in the panel. Perfect. So, yes, I think we can start. That's great. So, I would like just to tell you a little bit about myself. My name is Juan. I'm based in Barcelona, Spain, and I am a father through surrogacy. I have two children, my job is to help people who are going to the USA to do the same thing I did, right? To create their families through surrogacy and egg donation. And it is my pleasure to moderate this webinar today with Dr. Ringler of California Fertility Partners and Brad Spencer from Same Love Surrogacy. I'm going to let Dr. Ringler say a quick hello because then Brad Spencer is going to start the presentation. But before I do that, a little bit of housekeeping, just very simple. You will see in your Zoom window an icon called Q&A, that's questions and answers. And you can write in there any questions you have, and we're going to answer all of them right at the end of the webinar. You can also write your questions if you feel more comfortable in either English, Spanish, French, or Italian. Then I will translate those questions for Brad or Dr. Ringler, and I will help you with that. So please feel free to write all your questions there whenever you want, and we'll address them right at the end. So, Dr. Ringler, would you like to say hello to our assistants? Thank you.
Hi, hello everyone. Thank you for joining us today. So, Brad and I are looking forward to talking with you about family building through surrogacy in the United States. It's a wonderful process that gives our patients, gives you as a prospective parent a very high chance of achieving a successful pregnancy. And we're going to walk you through the steps of how it works in the United States. And I'm very happy to be here with Brad Spencer from Same Love Surrogacy. We've been working together for the last 5 years, and we have a good working relationship. We're in constant communication, and we both really believe in providing our patients the highest quality medical care and service to help you build your family. So I'll let Brad say a few words, and then we'll start the program.
Great. Thank you, Dr. Ringler. So thanks everyone again. A few just joined now. Thanks for joining this International Family Building webinar, which we hope it will be helpful for your own personal journeys. And now I would like to introduce you Mr. Brad Spencer, who is the founder and owner of Same Love Surrogacy.
Thanks, Juan, and thanks, Dr. Ringler. Thank you for everyone for joining us today. It's a real honor to be speaking with you. Me and Dr. Ringler are both in Los Angeles today, in California, and we're going to walk you through the process. I have a presentation we will go through in detail, and then Dr. Ringler will present, and then we will open it up for many questions that many of you probably have about this exciting journey of building your family in the United States. So a little bit about Same Love Surrogacy and our agency. Our agency is a global full-service leader in egg donor and surrogate services, and we have locations here on the West Coast in Los Angeles and in Portland, and we've been doing this since 2014. So we've been building families all over the world since 2014. The agency is owned by myself and my two business partners who are also gay fathers and also have twin boys, just like myself and my husband. And that was really the inspiration for creating our agency and really giving back to the LGBT community. My journey started in 2013 here in Los Angeles. I created embryos. I had a surrogate here in Los Angeles, was very blessed and very lucky. We transferred 2 embryos, and we had a very successful and healthy journey with our twin boys born in November 2013. And the agency was formed right after that in 2014. So my boys are 6.5 years old now, and I really can't imagine my life without being a father. And that's really the inspiration behind Same Love Surrogacy. 80% of our attendant parents around the world come from the LGBT community, and the other 20% are heterosexual couples that we've been servicing throughout the US as well and building their families as well. What really separates Same Love Surrogacy from other agencies is our customer service. We are with you during this entire journey. We are with you 24 hours a day, 7 days a week. You have direct access to the owners of the agency. We are texting, we are updating you. So you never feel that you're on your own in this journey. It's a very emotional, very important journey, and Dr. Ringler and myself are here to guide you, support you during this whole journey. So that really sets apart the Same Love Surrogacy and the California Fertility Partners service, because we're with you during this entire journey. Just like I said earlier, our attendant parents are global. We've had babies in Europe, in Asia, in the US. So we've been working with attendant parents all over the world. What we do really well is, this is a really emotional and a really exciting journey, but we also have busy lives. So what we do is we're gonna work around your busy schedule. We're gonna set up meetings on your time when you have time to discuss the journey. So if you're in Europe, we're going to make accommodations for the time difference. If you're in China, the same thing. And with our team, we have people that can translate if you need translation services. So we have individuals at California Fertility Partners and Same Love Surrogacy that speak multiple languages. So we can speak to you in French or German, any language that you need during the process. With our agency, you're going to have access to 2 egg donor databases, and that's going to give you 300 egg donor profiles to look at. And the egg donor process is really the first step in forming your family. And Dr. Ringler will talk a little bit about the egg donor and the egg donor medical procedure. But the very early stages is identifying an egg donor. And with our agency, you have over 300 egg donor profiles to look at. Another nice thing about working with California Fertility Partners and Same Love Surrogacy is we are in California. And California really is the world leader in IVF, in egg donation, and surrogacy. It is the safest place to form your family in the world. And with us being based in Los Angeles, the surrogacy laws in California have been on the books since the 1970s. So it's a very safe environment, and you will 100% be the parents of your child. So there's no risks when you come to California. I want to talk a little bit about the approach at Same Love Surrogacy. We help you facilitate building your team. And you have 2 of the 3 providers that you need in your journey: an agency and an IVF doctor. So today's webinar, you have an agency owner, you have a world-class IVF doctor, and the 3rd person in this journey would be an attorney that we will help you select. This attorney is going to draft legal contracts between you and your egg donor, between you and your surrogate, and that attorney is going to ensure that you go home as the parents with the proper documentation. So these are the 3 individuals in your journey that we're going to assist with the process. The way it works with our surrogates is our surrogates are already fully pre-screened. So when we introduce you to your potential surrogate, you can be rest assured that your surrogate has already gone through a psychological evaluation. We've done a background check on your surrogate. We've done an insurance review on your surrogate to make sure she has insurance, and that her medical records have been reviewed internally here at Same Love Surrogacy. And then Dr. Ringler will also review the medical records as well. So these are the steps that are taken when we match you with a surrogate. The process for meeting your egg donor and your surrogate is called a match meeting, and that's the service we provide. You will have the opportunity to meet via Skype or in person your egg donor and your surrogate. So we facilitate these meetings to make sure everything is smooth and that the egg donor and surrogate is someone you want to work with in building your family. And then the other services you get is you, during your journey, have access to all of our vetted and professional service providers. So we work with social workers, insurance brokers, genetic counselors, attorneys. All of our resources are at your fingertips, and we're going to make recommendations and assist you during this process. One thing we do at Same Love Surrogacy is we really want to make sure the prices are fair. We want to make sure that the surrogate compensation and the compensation to the egg donor is fair. We want to make sure it's fair for all parties. We don't want to make the surrogate's compensation too high where you can't build your family. So we really constantly are checking and making sure the compensation is very fair, both for the egg donor and the surrogate and the intended parents during this journey. Most of the egg donors with Same Love Surrogacy are located in the US, primarily on the West Coast, with us being in Los Angeles, with SLS and CFP being in Los Angeles. These are going to cut down costs, and most of our egg donors and surrogates are here in California. And then the whole package is just the continual guidance you're going to get from Dr. Ringler and myself from the beginning until you're safely home and become parents. So it's a full service throughout the entire journey. Just a quick slide here kind of shows the support that we do for our egg donors and surrogates. You can see here some of our events that we put together to support your surrogate, to make sure she's happy, she's healthy, she's having a great surrogacy journey. Currently, we have over 50 surrogates currently pregnant right now. So we put these monthly events together in the summer, holiday parties. So your surrogate is supported, your surrogate is healthy, and that's just some of the service that we provide both to our surrogates and to our intended parents. So this slide I'm going to walk you through a little bit is the step-by-step. It's high-level information, but it gives you a really good understanding of how the process works. And the first step is going to set up a free consultation with Dr. Ringler and myself, and we're going to go through the process with you. We're going to make sure you're informed, you feel comfortable with the steps, that there's no hidden surprises, you know the expectations of how the journey works. And Dr. Ringler and myself do consultations all the time with intended parents, and it's one of the best parts of our job is meeting potential intended parents throughout the US and Europe. The second step will be identifying your egg donor and or surrogate based on your timeline. So you're going to tell us when you're ready to start, and we're going to identify an egg donor for you. Or if you only need a surrogate, we're going to identify a surrogate for you. So we're going to help you identify and locate your egg donor and your surrogate. Once you've identified who your egg donor is in the process, we're going to assist with setting up your appointment at California Fertility Partners. You're going to come to the clinic, you're going to do medical examinations, you'll give sperm donations. So you will meet Dr. Ringler in person, and we will start the process with you coming to Los Angeles. Once that's completed, we will start the screening process, and Dr. Ringler will be going into that in his presentation of screening and evaluating your potential egg donor and your potential surrogate. So all of that will be done by Dr. Ringler and his fabulous team at California Fertility Partners. Once Dr. Ringler gives us the approval to move forward, we will then work with the attorney to draft your legal contracts between your egg donor and you as an intended parent. And once those contracts are completed, we can start with the medication cycle. And as an agency, we're going to support you during that journey of either an egg retrieval from your egg donor or the embryo transfer into your surrogate and having your surrogate become pregnant. And then once you do become pregnant, this is the best part of the journey. We are supporting you all through the birth and the post-birth, providing you guidance, making sure that the desired result at the end of the day is a healthy pregnancy, both for the surrogate and for you as intended parents. And that's the best part. And Dr. Ring will tell you the best part is seeing the pictures of these amazing families with their surrogate holding the baby. That's the whole, culmination of an amazing journey when you see these families being built. And, we could talk all day long about amazing journeys we've had with individuals. A little bit about the journey and what it looks like. An average journey for a singleton pregnancy ranges between $155,000 and $165,000. And we put packages together that we can show you. It has a range because there's different variables that can affect the outcome and the price. We as an agency have very low and transparent performance-based agency fees. So it's a small fee to enter with our agency, but those services are provided during the process. The average time for attendant parents when they sign up is about 17 to 18 months. So when you start your journey, you can expect to become parents in about 17 to 18 months. The last 2 points here are there is a team of professionals, both at the clinic and at our agency, that are supporting your case. So you are fully supported. Dr. Ringler and myself meet every other week, and we discuss our cases together. We go into detail, and we've been doing this for the last 5 years, from 2014. So we're really making sure your case is getting the full attention it needs, and if there's any issues, we're communicating directly with you. And the last one is, a couple of our attendant parents that we've had successful journeys with, and our surrogates are getting pregnant 80% of the time with Dr. Ringler and California Fertility Partners. So that lets you know that, 4 out of 5 of our attendant parents become parents on the very first transfer. So with that, thank you for joining us, and I will let Dr. Ringler present to you guys now.
Thank you very much, Brad. So now Dr. Ringler of California Fertility Partners is going to cover the medical aspects of the journey. Thank you, Dr. Ringler.
Thank you, Brad. You make that sound so easy. And I want to tell everyone it really can be that easy when you're working with, experienced professionals to help you guide you through the process. And, Brad and I love doing this. We love helping our patients through the process to have a baby and build families. So now I work with California Fertility Partners. I'm one of the senior partners, and our practice has been around for a long time. And our practice is credited with creating some of the world's first IVF babies. So we can proudly say our babies are now 30 and having babies of their own. Because we've been involved since the beginning of IVF, we have always seen patients from around the world who seek us out for our expertise in IVF. So seeing patients from Europe, Japan, Asia is routine for us, and you shouldn't feel intimidated with the distance. We're accustomed to dealing with patients from other countries, and as Brad says, we have translators. So it really is a straightforward process. When you come visit us in Los Angeles, this is what you'll see. This is our waiting room. I'm just going to give you a little brief tour of our facility here. 4 years ago, we built a new IVF laboratory from the ground up with all new state-of-the-art incubators and equipment so that we could provide our patients and their embryos the best possible environment in which to begin their embryonic life. And I told our designers we need to have a window looking in the IVF lab so our patients could see where their embryos are created. For years, this has been a mysterious environment, but it shouldn't be mysterious. It's a wonderful space. And on my tour, when you visit, I will show you the window inside the laboratory. And this is just an interior view. Those little blue boxes are incubators on the tabletop. And this is our goal, to help you with a pregnancy that delivers a healthy baby at term. And one of my patients from China gave me permission to share this photo of his newborn son to help inspire others to pursue their dreams. And so what I'm going to do is walk you through the IVF process with surrogacy and egg donation. So you have introduction to the principles here. There's multiple factors affecting the success rate of IVF, and my goal is to give you the highest chance of success and on the first time. So patient age, which is primarily the age of the person contributing the eggs. If you're using an egg donor, all the egg donors are young. If you're using your own eggs, your age impacts the egg and embryo quality. Your ovarian age impacts how many of those eggs and embryos will be normal. And a normal embryo is called euploidy. The more eggs you produce in a cycle, the more normal embryos we will have for future transfers. Egg quality is important, sperm quality is important, the laboratory environment's very important. How those embryos are cultured impacts their ability to start a pregnancy. And then the uterine environment is also important. With surrogacy, the surrogates are very carefully screened. These are women without history of infertility, but history of proven fertility. So they really they are providing this optimal environment for getting pregnant and for carrying the pregnancy until term. Ovarian evaluation starts with a test of ovarian reserve, and that refers to how many eggs are present in the ovaries, how many eggs will the ovaries make each treatment cycle. And this is an ultrasound image. Those little black circles are called follicles. There's one egg per follicle. Every month, the ovaries recruit a group of follicles. In the natural cycle, one ovulates and the other ones die off. In an IVF cycle, we give hormones to push that entire group to grow and develop. So in all of our patients, we'll do a blood test of anti-Mullerian hormone, AMH. With a high AMH level, you'll make a high number of eggs, a lower AMH level, a lower number of eggs. So it gives us a way to predict how many eggs a woman will make in a treatment cycle. The factors affecting egg quality include age, lifestyle, stress, smoking are harmful to egg quality, excess body weight can be harmful, and how we stimulate the ovaries has an impact. So in my practice, when I'm monitoring my egg donors, I follow them very carefully and closely because I know if I give too much medication for too long, it can have a negative impact on the embryo quality. And my goal is to provide you, again, the highest quality embryo, highest pregnancy rate. Sperm is always important. The first time I meet intended parents, I ask them to do a semen analysis. The semen analysis is a very basic test, tells us about the quantity and quality of sperm. And if we see a parameter that looks a little less than optimal, I will treat patients with vitamins, antioxidants to try to improve the sperm quality before we freeze it. 95% of our patients utilizing surrogacy will freeze sperm in advance, and then that frozen sperm will be used in creation of the embryos that will be ultimately transferred into the surrogate. The only men I want fresh sperm on are men with extremely low sperm numbers that whose numbers may be, harmed by the freezing and thawing, but 95% of patients will use frozen sperm. The factors affecting sperm quality, certain medication, Propecia, if you're taking Propecia, I recommend you absolutely stop testosterone. It'll turn off sperm production. And then excess of anything, excess alcohol, excess smoking is bad for sperm. Anything that will increase heat in the testicles, steam rooms, jacuzzis, long bike rides are all bad for sperm quality. So as you're planning to start your family, we really want you to start working on your sperm and do things that you can help improve the sperm quality. There's supplements I will give, vitamin C, coenzyme Q10, folic acid. And again, in the IVF treatment process, the daily injections of hormones are going to push all of these follicles to grow and develop. The egg retrieval is about 11 or 12 days later. And the day that the eggs are retrieved, we're going to thaw a vial of sperm. If we have 2 sperm providers, we'll divide the eggs into 2 equal groups and give half of the eggs to each intended parent. They're inseminated by the term ICSI, where we inject 1 sperm into each egg, and this will give us a fertilization rate of about 75 to 80%. So the day after egg retrieval, we have a fertilized egg or 1-cell embryo. The next phase in IVF is we keep those embryos undisturbed in culture until day 5, and between day 1 and 5 to 6, about 60% of those 1-cell embryos will grow into a 100-plus cell embryo called a blastocyst. So we want as many blastocysts as we can obtain. Once they reach this stage, they're given a grade depending on their appearance, and these are some beautiful blastocysts you see on the slide here. And oftentimes today we'll biopsy them for genetic testing. Pre-implantation genetic screen or pre-implantation genetic testing is a procedure in which we remove 3 to 6 cells from the outer layer of that 100-cell embryo and send those cells to the genetics lab for analysis, and they'll tell us whether or not that embryo contains the correct number of chromosomes. Because even in young women of egg donor age, a percentage of the eggs and embryos will be abnormal. And what we see on average is about 60% of embryos will be normal, 30 to 40% abnormal. So in an egg donor treatment process, we want to make sure we generate enough eggs and embryos to have several normal embryos for each sperm provider, ideally. So let's talk a little bit about egg donation. As Brad mentioned, in their egg donor program, they have over 300 egg donor candidates. And the way egg donation works in the United States is, you start with a list of what characteristics are important to you, and you look through the candidates until you can find the donor that's right for you. We're a very diverse population here in California and the United States. I always tell my patients you can find whatever you're looking for. So you should search until you find the donor that you feel excited about. The egg donors are in their 20s, ideally should have normal body size, regular menstrual cycles, and a healthy lifestyle. We'll always check their AMH hormone level to make sure they're going to make enough eggs. If they've donated previously, we can find out how well they did before, how many eggs they made, and was there a pregnancy from that cycle. What about the surrogate mothers? Surrogate mothers are these wonderful women from across the United States. Many of Brad's are from locally here in California, which is wonderful. And they have children of their own, and they basically give a year of their lives to help others become parents like they are. Once Brad matches you with a surrogate mother, she comes to me to complete her medical screening. In general, the surrogates are between the ages of 21 and 45 with history of at least one term uncomplicated pregnancy. And they have a stable, supportive home environment. When they come to me for their medical screening, they have a thorough physical exam, uterine evaluation, infectious disease screening before they're medically cleared for the process. And then we're ready to move forward to contracts and then our embryo transfer. In the embryo transfer, we will thaw 1 or 2 embryos depending on the intentions of the intended parents. And under ultrasound guidance, this diagram makes it look really simple. It's not quite this simple, but we try to make it simple. And I take a narrow catheter, pass it through the cervix into the uterus, and release the embryo in a drop of fluid. And the skill of the person doing the transfer actually has an impact on the outcome. So I take great pride in how we do our embryo transfers here and our success rates. With respect to success rates, if you look at the far column on the left, the blue column is pregnancy rate with donor egg and surrogacy, and it's a little over 80% with delivery rate of right around 65 to 70%. And this is single embryo transfer with donor egg and surrogate. So these are wonderful success rates because these are the best possible conditions to initiate a pregnancy, because we're taking the high quality eggs that the egg donor provides, creating embryos to be genetically screened, and then we're putting this high quality genetically normal embryo into this perfect environment that the surrogate provides. So most patients get pregnant in the first transfer. If they do not get pregnant, we usually have extra frozen embryos for additional transfers. And that's why we want to make sure that the egg donor is going to make enough eggs and embryos to give us definitely a pregnancy from that first cycle and maybe an additional pregnancy. So what are the secrets of success in this process? I've been working with surrogates for the past 25 to 30 years, and I have to say experience matters. Experience from the clinic, the surrogacy agency, and the support staff. Attention to detail. My job is to try to make sure all these variables are as good as we can get them. That's why we want the highest quality sperm, highest quality eggs to make the best embryos we can, and then we put them into a carefully screened surrogate we think is going to give you the best chance of pregnancy. Egg donor selection, I always tell my patients, is very important. And I always offer to help my patients as they narrow down their search to a couple of candidates. I will review them with them to help point them towards a candidate that I think may give us the best outcome. The IVF lab is very critical, especially today when we're doing embryo biopsy, freezing and thawing of embryos. You want to make sure you're working with a team that has extensive experience and good outcomes with these techniques. And lastly, a supportive team of professionals. I have an amazing group of nurses here who help me, monitor and communicate with my patients throughout the treatment process. And I have to say, I've been so impressed with the team at Same Love Surrogacy because they are committed, they care, and they really follow my patients, their clients, throughout the treatment process. They go above and beyond. And you want to feel like you're well taken care of. And this is our goal, someday that you can have a nice walk in the park with your child through the process.
Thank you for that, Dr. Ringler. So we have a couple of questions. I have 3 questions at the moment, and I invite everyone to type their questions in the Q&A. They can type them in different languages, as I said, in English, of course, in French, in Spanish, or in Italian, and I will translate for you. So the first one is actually in French, and the question is, the process, how simple it is, or is it simple for singles? Right? I'm not sure if this person who is asking is a male or female, but maybe we can cover quickly both, right? Both singles, males and females.
I have single patients. I have patients as couples. It really doesn't impact it. I suppose if you have a partner, then you have someone to bounce questions off. But that's what we're here for. We're here to support you throughout the process. I think it's very important that you have an understanding and you can make an informed decision on the questions that come up. But between myself, my nurses, the team at SLS, you'll be well counseled and guided through the process. You want to feel cared for, and whether you're single or a couple, it really doesn't make a difference. What do you think, Brad?
Yeah, no, I think that's 100% correct. I mean, we've built families for single individuals, for heterosexual, same-sex couples. It really doesn't matter. It's the same level of service, same level of care, and really the same success rate. So, we really want to make sure that we take care of everyone and give them the option they want to build their family, because every person and every family is different, and we work with all types.
Yeah, and I have to say, I'm seeing more single straight men go through the process because they're ready to start their family, and maybe they'll have a partner comes along later, but they're ready to get on with life, and it's really that easy, actually.
Excellent, thank you for that. Another question: what information can I access from an egg donor? So, Brad, this one is for you.
Sure. So with our program, you'll get a login to our database and you'll see profiles of over 300 different women. And then on those profiles, you will see photographs, possibly a short video, her family history. So you'll see her parents and her grandparents if they had any kind of diseases. You'll know about her lifestyle, if she's at a university or a college. You'll know and get a sense of who this woman is. So our profiles are very detailed. It's about 8 to 9 pages. And you'll see the information about this woman before you would meet this individual. So you can make an informed decision if this is someone that you're interested in working with.
Excellent. Thank you, Brad. Another question. What is the success rate of twin surrogacies. So, Dr. Ringler, maybe?
Yeah, so we will either put back one or two embryos, depending on how the intended parents feel about the possibility of twins. It's interesting, over the last 5 years, we've seen a dramatic shift from double embryo transfer to a single embryo transfer, primarily to avoid twin pregnancies, because twin pregnancy is a high-risk pregnancy from the start. Most complications of pregnancy occur more often in a twin pregnancy. Higher risk of miscarriage, higher risk of hypertension, pregnancy, diabetes, and pregnancy. The big one, preterm labor and delivery. So most intended parents would rather avoid those risks, and insurance reasons, there's reasons to avoid twins. However, I still have patients who really hope for twins. And so if we're going to hope for twins, we're going to choose the best possible surrogate for a twin pregnancy. And when we transfer two embryos, of those pregnancies, the twinning rate is about 50%. So it's not 100%, doesn't guarantee twins, but you increase from 2% to 50%. It's a significant increase.
Thank you. Another question. Actually, this one is related. What is your position on twin surrogacy?
Okay. Yeah, I think my best medical advice is to transfer a single embryo because it's safer for the baby. It's always safest for babies to be born one at a time. But if my patients really are hoping for twins, I will transfer double embryo transfer. The surrogate's counseled, and as long as everyone's in agreement, and again, we're going to try to find the best possible candidate for a twin pregnancy, maybe a surrogate who's carried twins before without complications, or a woman who's carried large babies before to term without any complications. We really want to have a near perfect candidate. Wouldn't you say, Brad?
Yeah, I would say that for sure. And I think what we've done well with your team is, really identify a woman that we think would give us the highest possibility and the best chance for a term delivery. And this is usually a woman that's a little taller, and like Dr. Ringler said, a woman that has had, delivered larger babies, that has definitely always had full term, non-complicated pregnancies. So, we're going to match you with a woman that we think is going to give you the best opportunity, and, not a woman that's maybe small in stature and a small woman that maybe wouldn't be able to carry full term. So we would always bring that into the equation when matching you for a twins. And it might take us a little extra time as well. Many surrogates now, what we're seeing in our program is they do only want to do it one baby at a time. So, it might add a month or two extra to identify this person, this amazing surrogate that is open to twins. So you have to factor that in a little bit. It could delay your journey to parenthood.
The other option I've seen in the last year or two is patients who want two babies at the same time, rather than doing a double embryo transfer, have two surrogates and transfer one embryo into each to avoid the increased risk of a twin pregnancy. Also, it increases chance of having two babies born at the same time, because if you transfer two, 50% are twins, that means, one sperm provider is not going to have a biological child, whereas if you have two surrogates, one gets pregnant, one doesn't, the following month, you can do another embryo transfer. And so you have two babies born almost at the same time. And I had a recent case where they were transferred a month apart and they were born at the same time. So.
Excellent, thank you. A question about egg donors. How often can an egg donor donate eggs? Is there a maximum number of donations?
The American Society for Reproductive Medicine recommends to limit the number of donations to 6 cycles. This was sort of arbitrarily chosen as just to be a safe number. And also they factored in to minimize the risk of offspring living in the same geographic region, coming from the same egg donor and not knowing. However, our patients come from around the world, so that I think that's unlikely to happen. And I think most egg donors will do it 1 to 4 times, then they stop.
Yeah, that's
Excellent.
exactly.
Excellent. Thank you. Is it possible, another question, is it possible to create relationship with the surrogate for the future? And this is for you, Brad.
Yes, highly recommend that. This journey, your surrogate really becomes part of your family, and most of the surrogates in our program want to have that relationship after the journey. They want to get updates. They want to get photos of the first steps, the first smiles, the first crawls. So it is really important to stay in contact with your surrogate afterwards. And it's also a benefit too, because like Dr. Ringler was saying, many people want to have a second or a third child. And if you have this relationship with your surrogate, she can now be your surrogate for your sibling journey. And me and Dr. Ringler have done many sibling journeys where we use the same surrogate, and usually she needs to rest for about 6 to 9 months after the pregnancy. And then we can get her pregnant again and have a sibling journey. So you really do want to have a good relationship with your surrogate during the journey and also after the journey, because it does actually have many sibling journeys together.
And we should also say that if you have an open relationship with your egg donor may be known, throughout your life and their kids' lives. I have an intended parent with 2 sons who are going on to college, and they of course know their surrogate, they know their egg donor. They've been part of the family story for years. So the children know exactly how they were created, who helped dads create them. So it's a wonderful option if the egg donor is willing to get to know the egg donor too, so your kids have that information available when they ask.
Excellent. Thank you. I have a question here. What is considering too late, or what is considered too late to have children? Is it too late to have children in old age, like in the 50s? Can I say that 50s is not too old? But then please, Dr. Ringler and Brad, what do you think about having children in the 50s?
So I assume they mean with a donor egg. So for a woman cannot use her own eggs in the 50s, I mean, there have not been any reported cases. After age 44, a woman using her own eggs, it becomes extremely difficult without the use of a donor egg. I have had women in their early to mid 50s carry a pregnancy to term and do well using a donor egg. I'd say the upper limit is around 55 for women. Men have more freedom in terms of age because men continue to reproduce sperm throughout their lives. There are some increased risk of aging for men over the age of 40. It's a very gradual increased risk of some genetic changes in the sperm. But I've had men in their 80s contribute sperm for new children.
Yes,
Yeah.
I think also what maybe they were asking is the fact of going with a surrogacy and egg donation journey at age 50 something. And then Brad probably has had quite a few cases.
Yes, we've had many attendant parents where both attendant parents are in their 50s. My personal belief is, the 50s is the new 30. There are a lot of our attendant parents that are young and vibrant, and they've maybe put their careers or their family life first, and now they're in their 50s and they're ready to have their children. So we have no issues, and we've had many successful cases in family building with attendant parents in their 50s.
Okay, so I have a question here, actually, referring to what Dr. Ringler said earlier about what we call dual surrogacies. But the person is asking, hence, how do you treat sibling surrogacies? I mean, I think that he means dual surrogacies in that sense. And what is the consequence on the overall cost?
I'll just say a few minutes. I think I'll turn this over to Brad. The advantage of having 2 surrogates is you avoid the increased risk of preterm labor and delivery. And because if you have a preterm delivery of twins and your babies are in the neonatal intensive care unit, the hospital bills are hundreds of thousands of dollars, okay, up to $1 million. So by avoiding that, it actually ends up being, of course, much cheaper to have two surrogates because you're avoiding the risk of those high medical costs. So I will say from the medical perspective, there's a, cost goes into creating embryos. The cost of transferring embryos is really very low compared to the cost of generating the embryos. To transfer to another surrogate, it does not significantly add to the cost.
Yeah.
I'll let Brad talk from the surrogacy agency side.
Yeah, and for the agency, we give discounts for a sibling journey or a second surrogate. So there are cost savings in doing it this way. The attorneys will also give a discount because you're doing two contracts simultaneously at the same time. Like Dr. Ringler said, from the medical side of things, creating your embryos is the largest amount of the cost. So you've already created your embryos, so it's a nominal expense to just transfer and screen a second surrogate. But there definitely is cost savings along the way if you start your journey and identify that you'll be doing it with two surrogates simultaneously at the same time.
I think it's important that intended parents, if they plan to do it, realize that each of their surrogates deserve, attention and support, but my intended parents have had no problem, giving 100% support to more than one surrogate.
Right.
So.
Excellent, thank you. Another question. What is discount offering in GPAP stage 1 for your service?
So for our GPAP 1, discount is 15% off the agency fee. So we take that off of the surrogacy agency fee.
Yeah, I think ours is similar, maybe 20%. I'd have to ask when having babies for the details.
Okay, no worries. But I think we can say that Same Love Surrogacy and California Fertility both participate in the GPAP program, right?
Correct.
So
and
we can.
Yeah, and both Dr. Ringler and myself are on the advisory board, the board of directors. So you have direct contact with men having babies. So we are big supporters of the program and men.
Excellent. How long does the whole process? How long does it take for the whole process? Sorry.
So
Go ahead. I was just going to say about 1.5 years. From the time you select your egg donor, we're creating embryos about 6 weeks later. Your embryos are frozen, and then there's a little delay until you have your surrogate match. But then once your surrogate's matched, 6 weeks later, we're doing an embryo transfer. So it moves along steadily.
Yeah, and I think the big component is how fast the intended parents want to move as well. So we have some intended parents where it might take them 2 or 3 months to find an egg donor because they have a long list of qualifications they're looking for. And there's some people that, will move quicker with selecting an egg donor and selecting a surrogate. So a lot of the time frame also depends on the intended parents and their time frame as well. If they want to move quickly, the process can move quickly.
Excellent. Thank you. We have last question at the moment. So what happens if the surrogate changes her mind and wants to keep the baby?
Well, I can answer that. The good thing is this hasn't happened in the industry. There have been a few women, I think maybe 3 cases in the last 20 years where the surrogate mother has tried to, and all 3 times the surrogate has lost and the intended parents have had the baby. So it's very rare. And the reason it's rare is what's called a pre-birth order, or once you become pregnant, in many of these states, your parental rights are established before the birth. So what that means is your attorney has gone to the local judge or the local courts in the state that your surrogate is at, has gotten you an official judgment naming you and your partner as the parents. So this is done before the birth. So when you arrive at the hospital and your surrogate is delivering, the hospital already has on file the official judgment that has named you the parents. So it really is impossible for a woman to try to take the baby after the birth because all the documentation and the parental rights has been established before the birth. So it's a very rare occurrence nowadays. And, these surrogates are psychologically cleared beforehand, and many of the surrogates know the journey that they're taking part at. And it's funny, but many surrogates already have 2 or 3 children of their own, and the last thing they probably want is a newborn baby at home. So many of these surrogates, the most joyous day is handing the baby and having this celebration at the hospital, because at the end of the day, they just aren't looking to take home a baby, when their family is already complete. So, but that's a really great question.
Yeah, I just want to add, I agree with Brad. These surrogates are so carefully screened by a clinical psychologist, by the agencies, by the clinics, about their motivations in the process. And most, with only about 10% of applicants are accepted, but they're so carefully screened that I've never seen it happen. And these surrogates are really committed to all that they do for that one day when they can hand over that baby to you and say congratulations. That they're real. That's why they do this.
Excellent, thank you. Oh, one last minute question just came up. This one is for you, Dr. Ringler. Is it recommended to do a semen DNA fragmentation test? I suppose that's what they mean.
I think it's a good idea. It's not a necessity. In my men with abnormal sperm numbers, I will order it. Because men with high DNA fragmentation can make fewer blastocysts and can have lower pregnancy rates, higher miscarriage rates. And there's a new technique to separate out sperm in a sample with lower DNA fragmentation. So if a guy has high DNA fragmentation, there's a new technique called Zymot. It's a microchip the sperm are processed through. I've seen guys with 60% DNA fragmentation, and our goal is less than 20. Post-Zymot ends up with less than 10%. So for men with abnormal sperm parameters, it's a good idea to do because there's things that we can do with that information that can impact your outcome.
Excellent, thank you. I think we had great questions today, really fantastic. I think we've covered a lot of very helpful stuff. I would like just to point out and to remind, because Brad brought it up earlier on, that Dr. Ringler and Brad have worked and they have developed a joint program which covers all the aspects of the journey. It covers the medical aspects, of course, for the egg donor, the surrogate, and intended parent. It covers the egg donor portion, and it covers the surrogate portion, and it's all covered by this joint program between Dr. Ringler and Brad. I invite you to find more about this program and also about any questions that you have in a private consultation, which you can book with either of them complimentarily, so you don't have to pay for this consultation. And there you can ask all the questions relevant to your personal circumstances. I will be sending you all the contact information for Brad and Dr. Ringler, and then you can contact them directly and set up those calls or those Skype calls, those appointments. Also, this webinar has been recorded, and you will get the link to the webinar, and you can watch it again or share it with somebody else who would be interested in watching it, and you will be receiving that. And I would like to thank very much everyone who has joined us and who has participated, and I'll let Dr. Ringler and Brad to say goodbye to you.
Thank you for great questions and for watching. I had fun, and I'm always available for questions. Juan will give you my email. I'd love to talk with you.
Yep. And I'll just repeat the same thing. Yeah, we would love to work. It's a passion that me and Dr. Ringler have had, building families around the world, and we're available for any kind of private consults, any kind of one-on-one direct questions you have. We're always available to speak with future intended parents.
Great. Thank you very much, everybody, and have a lovely evening or a lovely rest of the day. Thank you.
Thanks, everybody.
Thanks,
Bye-bye. Thank you. Thanks, everyone.